Good morning, everyone. Welcome to the first annual New York City UNICEF Collegiate Conference. I'm Michelle Chen, a senior at Columbia College and the president of Columbia UNICEF Club. Thank you to each and every one of you for being here with us today. And thank you to all of our wonderful club members who have worked so hard to make this event come together. The topic for this year's conference is the global child refugee crisis. We strongly believe that every child has the right to survive and thrive in this world. However, a record number of refugee children, an estimated 31 million, have been forced from their homes by circumstances beyond their control. Whether they are fleeing extreme poverty or brutal violence, their aim is the same: to find a way to live safely in a place where they have a better chance at the future. I remember my first visit to Disneyland and how fascinated I was of the ride, It's a Small World After All. My boat floated by the animated dolls dressed in traditional clothing, singing in unison that a smile means the same thing to everyone. In my youthful mind, the people of the world, diverse as they were, could really live in unity and peace. I used to think that it was just my childhood naivety that caused me to believe that such cooperation is possible, but I still believe it, even more than before. I learned that it might be easier to ignore the problems in this world that does not affect us personally, and way more comfortable to tune out those who are not similar to us. But I like to challenge myself, and I hope that you will do the same, to try to understand the complexities of other people's lives. Each person has her own hopes and aspirations. We can work together to listen to one another, to look out for one another, even if it does not directly benefit ourselves. To that end, we dedicated this year's conference to the pressing topic of the global child refugee crisis, and brought together leading scholars, professionals, and the humanitarian organizations to share their insights and facilitate a conversation. By taking actions ourselves, we hope to also motivate those around us to ameliorate the current situation and to seize every opportunity to make the world better. So without further ado, I'll pass it on to Nyenhuis to introduce our first speaker.
Good morning, everyone. My name is Nyenhuis, and I'm the head of external communications at Columbia University UNICEF. I'm so excited to be here, and I thank you for spending your morning with us. It is my great honor to introduce our keynote speaker for this event, Michael J. Nyenhuis. Michael is the president and CEO of UNICEF USA, bringing in over 25 years of global humanitarian and development experience, fundraising acumen, and proven results to this role. Before joining UNICEF USA, Nyenhuis was the president and CEO of Americas, a position he held since 2014, and he was also the CEO of the global nonprofit MAP International for 13 years prior. A former journalist with a passion for global health, he previously served on USAID's Advisory Committee on Voluntary Foreign Aid and chaired the board of the Integral Alliance, a global network of faith-based NGOs. He also currently serves on the board of Interaction, the largest coalition of US-based relief and development organizations working internationally, and the Leadership Council at Concordia, an organization and forum that promotes cross-sector partnerships for social impact. A Minnesota native, Nyenhuis holds an MBA from Emory University and a Bachelor of Arts in Urban Studies and Communications from University of Wisconsin-Green Bay. I present to you Michael J. Nyenhuis.
Good morning, everybody. I'm very, very happy to be here with you this morning. And thank you so much for taking your time on a Saturday. And if you're in the New York area, it's a beautiful Saturday. It would be lovely to be outside, but there is no more important issue than what we're going to talk about today. So thank you for that commitment. And generally, thank you for your commitment to UNICEF, to our work around the globe, to the strength of our UNICEF Clubs program, and specifically to the work at Columbia or at the other institutions that some of you are a part of as well. I know that I'm addressing you at a very interesting and unprecedented time for all of us, but for you as students in particular, it's been an incredibly disruptive time, but really important time to remember that we still have work to do. You have work to do personally in your studies to build the pathways for your future, and we have work to do together to continue to build pathways for the future of children around the world. So again, thank you so much for that time. I want to do just a few things with you in the time I have this morning and try to do them as briefly as I can so we can preserve time for some conversation. Questions that you might have, ideas that you want to put forward, things you want me to hear from you. So I want to preserve as much time as I can for that. I think that will be the richest part of our time together. So please be thinking about questions and comments you want to put forward, and I will love to address any of them and to hear your points of view as well. But the few things I'd like to do is to start with the global refugee crisis, which is your topic for the day. Just talk a little bit about that and about why it's so critical at UNICEF that we rally around that particular issue. I want to raise an issue high on my priority list that's reflected in the refugee crisis, but has also been exposed very broadly through the COVID pandemic, and that's the issue of equity, in particular around health and education equity. And then I just thought I would tell you just a little bit of my own story, my own journey to get here to UNICEF, and some sort of points along the road that led me here, just as a little bit of a example or object lesson for you, and maybe add a little bit of advice to you as you think about your own futures. And then finally, just briefly want to share a little bit of my vision for the UNICEF Clubs program, which I think is such an incredible asset that we have. So let me see if I can run through those relatively quickly so that we can open up the conversation with all of you this morning. So let's start with the global refugee crisis. You've picked the right topic to talk about today, even in the midst of the COVID pandemic, which is maybe what's on everybody's mind right now. I've talked to a lot of people about the COVID moment that we're in as being a both and moment. And what I mean by that is COVID, we have to pay attention to it. We have to address it. UNICEF is doing that in some terrific ways, and I'll touch on a couple of them. But in the midst of that, we can't have our attention drawn away from the rest of the critical work that UNICEF is involved in. And so much of that is focused on refugee children around the world. So it's a both and moment. Let's deal with COVID. Let's pay attention to it. Let's make sure we're mobilizing the resources and the efforts to defeat COVID. But at the same time, it's an and moment. We have to remember the core work that continues to go on. As you heard, there's 31 million children forcibly displaced from their homes from violence, conflict, or natural disaster around the world. This is the worst situation for refugee children since World War II. And I just want you to stop there for a minute and just think about that. Like, don't let that number and that statistic, worse than after World War II, don't let that just numb you or kind of run past you. Just stop and think about that. 31 million children, the worst global refugee crisis for children since World War II. It's at the heart of the work of UNICEF. UNICEF was founded after World War II to provide relief and support for children after the war. That's what's in our DNA. Children in crisis because of conflict is the bedrock and the foundation for UNICEF. It's where we grew out of and continue to work in. So just imagine that the situation today is worse than when UNICEF was founded, when there was a global recognition of the need for something like UNICEF to provide relief and support to children who've been affected by conflict and displacement. And the situation is worse today. So there's all the more need for UNICEF and all the more reason for all of us to rally around the work of UNICEF. And I just want to just imprint that with you, again, as you think about all the things that you are dealing with, your studies in the midst of the pandemic, your other activities, that this work that you're doing with UNICEF and for UNICEF is critically important today. UNICEF addresses, obviously, the refugee crisis all over the world and in many different ways. And you know, I've had a chance to be in Jordan, working both in refugee camps, but also in host communities where Syrian refugee children are trying to make their way in two different kinds of settings, in a refugee camp and in a host community. The reality is that most refugee children are not in refugee camps, they're in host communities, and that puts pressure not just on those families, but the families in those host communities. And so I say this is another kind of both and moment. We have to be thinking about the refugees, but we also have to be thinking about the communities that are hosting them around the world and the impact on the children and the families in those communities as well. So as we mount efforts to tackle the issue of refugees, we have to think carefully about how they integrate well into host communities and become an asset to those communities, not just another competition for resources in those communities. And UNICEF does this extremely well, working to build up education systems and health systems and child protection systems in those kinds of communities, for sure. So as we think about global refugees, one of the issues that comes to mind for me is equity. And I think about this in particular in the area of health and education. I think this is should be the topic that is, you know, at the top of all of our minds, is the issue of equity. How do we ensure that quality healthcare for refugee children and quality education for refugee children in the same way that we do for other kids? So UNICEF's done some really interesting things. We've developed a program with Microsoft called the Learning Passport. What this does is it provides opportunities for refugee children who have access to some technology where they are to be able to tap into their national curriculum back at home, so they can keep up with their own national curriculum even when they are outside of their country. This allows them a path forward, so when there does come an opportunity to return, that they're not so far behind anymore. And so I think there's some real innovations that we've done that help provide equitable access to the curriculum that students so much need just to be able to keep going forward. And in the area of healthcare as well, there's just such a need to make sure that refugee children have access to quality healthcare. That's done, I think, extremely well in refugee camps. I've had the chance to visit many of them, and the refugee camp medical systems are pretty good, actually. Overwhelmed, of course, because so many people, but pretty good. But again, the concern there to me is in the host communities, where the pressure on local health clinics and on hospitals is really high. So how do we build up and strengthen the work of those local clinics and local hospitals that are dealing with inflated populations, and make sure that access is equitable to both host community members and the refugees themselves. I've done work recently along the Venezuelan border in Colombia. In my work at AmeriCares before coming here, we ran 10 primary care clinics to provide good quality primary care for refugee and migrants from Venezuela who'd crossed over into Colombia, to make sure that they had equitable access to good quality healthcare as they came in and started new lives in Colombia. But that issue of equity is, I think, sort of across the board, and it's been laid bare again, I think, by the COVID crisis, even here in our own country. If you look at the impact of COVID, the higher impact on communities of color in our own country points to the issues of lack of equitable access to healthcare and education. So we know that families that are in much better financial condition right now, especially in this moment of COVID and the education crisis, have so much more opportunity to try to stay ahead stay up with their own curriculum and their own studies. And many of you are, and again, I realize it's a struggle, but you're able to take advantage of the tools and the technology and the support to make the best of this current situation. But there's so many families in our own country that do not have that opportunity. And there's not equitable access to education right now. Seen that again in other countries too. I mentioned the learning passport we have, which is requires some technology, but gives refugee kids and also children who've been displaced through COVID, displaced from school from COVID, an opportunity to access their curriculum. But what if you don't have that technology? Lack of equitable access to education is a real problem. I was talking with our team in South Sudan, and there, where there isn't the level of technology that they need in some of the poor communities where we work, we've worked out agreements with radio stations to broadcast national curriculum over the radio, which is the primary source of media there for children to be able to access their curriculum over the radio. We had a chance to meet virtually a couple of children who were in their small little homes with their notebooks out, listening to the radio, picking up curriculum. But you can imagine how difficult that is too. That's lack of equity and access to education as well. And in the health situation, remote communities, are in the same position as refugee communities, often not having good access to healthcare. I was in Nepal after the big earthquake there a number of years ago, and remote communities which had very small, not well outfitted primary care clinics in their communities, but at least they had something, that were destroyed by the earthquake. And it was going to take the government a long time to figure out how to do that. And so I was part of an effort to build new primary care clinics in these very remote places to provide equitable access to healthcare for families that had lost basically everything in the earthquake. And so we made sure that we built clinics that were exactly to the specifications of primary care clinics that would be built anywhere else in the country, despite the difficulty of getting materials to these remote places and constructing and outfitting these clinics. But it was important to do the same thing for those rural communities as people in more urban settings would get, again, equitable access to healthcare. So I want you to think a lot about that as you think about the work of UNICEF around the globe and the things that you want to really promote both here in our country and around the world, is how important equity is as a principle in the work that we do. So let me tell you just a little bit about my own journey to get here. And that may prompt some thoughts and questions from you too, and really what drives my work here. And then finally, I'll just share a couple of thoughts about the club program and then turn it over to you for some conversation. I actually started my career as a journalist. Was spent about 10 years doing that, but even to get to journalism was a little bit of a curvy path. I went to undergraduate school really to study environmental science, thinking that I wanted to be involved in care of the planet, which remains a critical issue today even. While I was in undergraduate school, I had a friend who was writing for the campus paper and said it was a great group of people and it was kind of fun to do. So he invited me to come along and do that, said you could write about environmental issues at the paper. So started to do that, fell in love with writing, fell in love with journalism, ended up finishing my degree and pointing toward journalism, spent about 10 years doing that work and quite happy with it, and did some international reporting and one trip doing reporting in Central America. I ended up in a small little village and I met a local nurse there who was just a dynamo. She was just changing things in her community. She had a vision for how to improve things for this very poor community that she grew up in. She'd gone off to nursing school, with her intention of going back to her community to set up a health post. On the way, she went through a community health training program, and community health basically deprograms medical people to think not just about disease prevention, treating diseases, but think about public health. Think about how do you promote good health in a community. So she set up shop in her little village and spent 90% of her time working with families on health and nutrition, sanitation, working with farmers on better agriculture techniques. She was a real public health specialist and just a dynamo. And she was really changing things in the community. And while I was there, I had this sort of epiphany. It's like, I think rather than just report on people like this, I want to help them. I want to figure out how to help people like that. They have a vision. Why don't we just find people like her and help her do her work? That's how we're going to get things done and changed. Like who am I as an outsider to even know what's needed in this community? But she knows, so let's just get behind her. So that put me on a path to find the organization that trained her in community health practice, because I figured they must know what they were doing. And that was a US-based NGO called MAP International. Ended up connecting to them, joining them on the communications side of the house. And after a while kept getting leadership positions there and ended up the CEO at MAP. And that led me to becoming the CEO at AmeriCares, which is a global health focused organization based in Connecticut. And then last October, quite happy there, 6 years of leading that. I got a call from a recruiter talking about the job at UNICEF USA. And if you've been in my line of business for 25 years, humanitarian and development work, when someone calls and says UNICEF to you, you stand up and listen. There's no bigger global platform to impact kids around the world than UNICEF. And there's no more important or noble mission than to help children. So that was an easy decision for me to come and really have the privilege of coming and taking this job, which I took and started on March 30th. By then, the pandemic was already raging. New York was shut down. I haven't worked a single day in a UNICEF USA office. I've done it all remotely. It's been very interesting. Haven't been back to the field to see the programs firsthand. So it's been a very interesting first 7 months leading this organization. But one thing that I have seen and learned is the power and strength of our clubs program. I've had a chance to interact with a lot of our youth leadership, with a number of clubs around the country, both high school and college clubs. I think this is an incredible asset that we have, the power of all of you, your voice, your energy, your ideas, your commitment to this cause. And as we grow UNICEF USA over this next period, I'm very excited to see us continue to invest in the clubs program and to grow it even bigger. We need to mobilize an entire army of youth around the country who will advocate strongly for child rights globally and here in the U.S. too. And people listen to you. We have great success, and many of you, I'm sure, have been part of these efforts to meet with legislators and for them to hear you. They will listen to you, sometimes more than us. And so we need to really leverage the strength, again, of your voice and your energy and your ideas, and make sure that we're channeling them in ways to really push the priorities that we have, legislative, public policy, public opinion priorities that we have, and utilize your energy and your voice. So I want to encourage you to be active in the club, even in this very odd time that we're all in. I want to encourage you to continue to reach out, bring more people in. And as you complete your studies and sort of head out into the world, there are other ways for us to stay connected with you and continue to have you be a part of the UNICEF family that you are now a part of forever. So I'm going to stop there, and I want to turn it back over and be available for questions, thoughts, ideas. So let me hand it back to you.
Thank you so much, Michael, for that very informative and inspiring speech. We're going to dive right into Q&A. So if you have a question for Michael, please put it in the chat and we'll get to as many as possible. So we already have a really great question from Carissa. Carissa is part of a group of people who started a nonprofit called Safe Haven, and they bring mental health awareness and services to immigrant and refugee communities in the DMV. She was wondering if you could talk about the importance of mental health for refugees, particularly in the resettlement process. And there's a lot of stigma surrounding mental health seen in our community.
Yeah, it's such a great question, and mental health is a UNICEF priority. In fact, if you listen to Henrietta Fore, UNICEF's executive director, she talks about 4 big priorities for UNICEF coming out of COVID, and mental health is one of them. So you're going to see and hear a lot about that from UNICEF. I just want to tell you a story from my own experience that really sensitized me to this issue and why I put it as a high priority in the work that I've done previous to coming here and will continue to while I'm here. Years ago, after the big Asian tsunami that struck Indonesia and Sri Lanka and lots of other countries in the region, I was in Sri Lanka on the eastern part of Sri Lanka that got hit very badly by it. And I was visiting medical camps that had been set up to provide healthcare to devastated communities devastated by the tsunami. At each of these medical camps, I would talk to the people who were running them, and I would ask, what do you need? What can we provide? What would help you get your work done? And I'm expecting things like, we need more drugs, we need more gloves, gauze, and bandaging. We need more technicians. I need some more nurses. We need a better facility. That's what I'm expecting to hear. And I did hear some of that. But one by one, the first thing I heard from people is, we need mental health counselors. Half the people standing in line to get here, to get into the clinic, don't really have any physical ailments. They're traumatized. They have real mental health issues from this experience, and we're not trained to deal with that. That's not our thing. So we're providing not the kind of care these people need, and meanwhile, that's taking up our time from the people who have the physical ailments that we can really deal with. If we had mental health counselors, we would be so much more effective. So I heard that, that was 15 years ago or something like that. And that's been it's always resonated with me about the power of that. So in the work that I did at AmeriCares before coming here, we built a mental health program into our disaster response work that dealt with, refugees from both conflict and from natural disasters. And that work actually was focused on mental health training for primary care physicians and nurses and other medical people in a primary care context, to give them the basic tools to be able to deal with mental health when people came in and that was the real issue. So I really appreciate the work that you're doing on this and the attention you're giving to it, and just I guess want you to hear that it is a high priority for UNICEF and needs to be.
Thank you so much for your answer, Michael. Carissa, we have on panel 1, Dr. Sam Dawood, who is the founder of Humanity Crew, and they provide mental health services to refugees. So you could join that panel to find out more. We have another question for you, Michael, and it's, what is your greatest lesson since you started UNICEF, or since you started as the CEO of UNICEF, rather?
Yeah, adaptability. Again, when I took the job in January, when I accepted the job in January, COVID was a thing, but not a big thing. At that point, had no way to know that it was going to shut down everything. And I think, coming into the organization, both coming to know the organization, to know my team, for them to know me, for us to begin to think about strategy and direction and where we want to go, to interact with my board of directors, our key donors, our UNICEF colleagues all the way around the globe, and do that all through a video conference has been, it's been a challenge to do that, not to have sort of face-to-face time with people, the loss of some of that informal time that you get when you are just hanging out with folks is, I think, been difficult. So we've been adapting the way we work constantly. I mean, I'm not telling you guys anything. You're doing it too, right? Just in your own schooling, your work, your family life, your social life, trying to figure out how to make this work in the midst of a pandemic. And then I would say, sort of on the UNICEF side, being able to ramp up COVID-related programs while trying not to slow down all of the ongoing work takes incredible adaptation. So, just giving you an example of that I gave you of South Sudan, of the education program there, that's using radio to broadcast curriculum to students. So you can imagine for our education staff in South Sudan, when suddenly those kids are out of school, and they don't have they're not going to be doing Zoom calls. So how are you going to do that and keep them together? So the innovation that happens there when you can adapt to the situation and use radio in a different way. You don't think of radio as an innovation, but the use of radio to deliver curriculum to students who are out of school in the midst of a pandemic is in fact an innovation, and it's adaptation probably at its best. So that's, I think, been the theme of the day.
Yeah, and I was going to actually ask you a question about adaptability. So it's wonderful that you already answered that. My next question is about the crisis. And as you said in your speech, it's the worst, or it's the worst since World War II. Why do you think it's so difficult to put an end to this crisis? What is the hardest part of it?
Well, I think at the root of so much of what's going on today is internal conflict in countries, right? So World War II was a different kind of thing. That was a global war, nation against nation. What you have so much today is civil war. You have internal conflict, and that's what's pushing people, pushing families and children out, is the internal conflict. And it's actually considerably harder to deal with an internal conflict because within the borders of a country, what happens within those borders, for the international community to be able to impact that, we don't have a great track record on. In fact, typically the international community is going just the other way. They're part of the fuel that's fueling internal conflict. So I think that's what makes it so difficult and so much different than a World War II setting, is the internal unrest, civil war, crisis happening within the boundaries of a country. And I think it's complicated. At the root cause of all of that, typically, is good governance. I was asked one time, what's the biggest issue that you really need to tackle? And I still think at the root of everything is good governance. If countries are well run, are inclusive of their populations, if the governments have in fact the best have the best in mind for their citizens, things do pretty well in a country. And when that changes, things get bad. So I think that's kind of what's at the center of it.
Thank you. Thank you for that answer. And so we have 3 more questions in the chat, but they're all very similar. So I'm going to try and weave them together. And it's people asking what they can do in their communities to help bring awareness to this topic. And one person is from Germany, another person is also international, and the last person is still in high school. So how can all these different people, whether it be being international or still being as young as in high school, how can they help solve this problem, this crisis?
Yeah, well, I think awareness is really important. Again, if a plane crashes, everybody hears about it, and it feels like urgent. If a typhoon hits somewhere and it's a big thing, people hear about it, and it feels urgent. The problem with the global refugee crisis, particularly refugees displaced by conflict and violence, and even economic insecurity, is that it seems intractable. it seems like these things go on and on and on and on, and they do. And I think our problem is maybe as human beings generally, but I think it's true here in our country as much as anywhere, is short attention spans. After a while, we get numb to these intractable problems that exist. And that's why I kind of started this morning, just wanted to pause on that figure, 31 million children, a worst crisis, the worst crisis since World War II. And if you just stop on that and think about 31 million children and put that in some kind of context, you recognize that that's, it's a problem we have to deal with. Of course, one of the problems is when you just stop there, 31 million children, it seems like an intractable problem. Like, what can anybody do? Which is why we have to tell the stories of individual refugee children, what their circumstance is and what they need. We need to put names and faces on these. I talked to a couple in New York recently who become major donors of ours. And they weren't really paying too much attention to any of this until they saw images of a young Syrian boy who was a refugee trying to reach Europe with his family, and he died on the way, and his body washed up on the beach. Some of you may remember this from a couple of years ago. They were so moved by that one boy, it made it real to them. This 31 million number, it was made real to them by that one story. So I think you have to do both. We have to just recognize the scale of it, but at the same time, we have to put a human face on it and help people understand that these are children just like our own, and we wouldn't tolerate what's happening to them with our own children. I read a book recently called Tears of Salt. It was written by a doctor in an Italian island in the Mediterranean, close to the North African shore. And it was a kind of remote place without a lot of happening on it. And he became a doctor, and he moved back there to be kind of a rural doctor in this idyllic island that he grew up on. And it became a center of a refugee movement. So a lot of refugees leaving North Africa by raft would end up on this island. And he became basically a refugee doctor, meeting these rafts and these boats in the harbor of this little island and taking care of people. And the book, I recommend it to you. It's just a personal, it's just short chapters, story after story, some of them incredibly heartbreaking as he recounts the stories of some of these refugees, and some of them incredibly uplifting in the resilience of people in these circumstances. And he just tells the stories of these people, and it makes it real. And so I think that's partly what we need to do, is make it real for people.
I think that's a very brilliant point. And I do remember the picture of the boy and how that moved so many people, including me. So I think that's putting names and people to faces. I think that's super important. We have another question from Mark, and Mark is actually one of our invited guests. So welcome, Mark. Thank you for your question. He says, could you speak to the challenges that are for IDPs and how they are distinct from challenges that refugees face?
Yeah. It's interesting. And again, I'll go back to IDPs, internally displaced people. I'll go back to my point about internal conflict versus sort of the more traditional in the past, like World War II, nation against nation. Refugees have, I'm careful how I say this, so I don't paint a picture of refugees having any kind of good circumstance, because they don't. But there are systems set up to deal with refugees that cross borders. That's why a lot of people do that. They cross borders. There are refugee camps that are set up in these big things. There are services provided by lots of NGOs and UN agencies in host communities to try to help integrate them, because they've crossed a border from a place in conflict into a place where NGOs and UN agencies can operate pretty easily. The problem with the problem that IDPs often face, especially in places of conflict, is that they're internal within their own country, and they're in places that are very difficult to get to. They're in places that still may be in conflict. There may be places where NGOs and UN agencies aren't as welcome to be able to do the work. They, I think, tend to be the more silent or hidden, maybe is a better way to say that, a more hidden problem than the refugees who cross borders. So we do need to think really carefully about them and about how to serve them in a different way than you do with refugees, because the constraints on serving them are higher.
Thank you for your answer. So we have a minute more, and so we have two more questions. The first question is, can you name some refugee camps that you are currently working in or planning to work in?
Well, again, there's lots of them around the world, whether it's in Cox's Bazar in Bangladesh with the Rohingya, or whether it's the camps in Jordan where we're working with Syrian refugees. So there are unfortunately way too many of them around the world. So pick the crisis and where are the refugees, and you're going to find UNICEF there. Working to provide those kinds of services. And again, I just want to reemphasize that most refugees are not in camps; they're in host communities, and those need as much attention as the camps themselves.
For sure, I agree. Someone asked a very beautiful question. When we have lost all hope and the crisis seems super insurmountable, how do you stay hopeful?
Well, I just go back to this book that I mentioned, Tears of Salt. I can't tell you how many chapters I read that were just incredibly depressing, and you just want to put the book down. It's like, I don't know. And then you read the next chapter, and it's one of resilience and overcoming, and you go, there's hope there. Maybe just one other story. Years ago, I took a group of donors with me to visit a project we were doing in Ecuador, in the jungles of Ecuador and the Amazon River Basin. And the needs there are so great. It's really remote, very little government service, very poor, especially at the time. And I took this group of donors along, and one of the couples had brought some friends along that we were hoping would become donors. And at the end of a several-day visit, we were debriefing on everything we had seen. And the husband of this other couple that we had brought along as kind of prospects, as we were debriefing what we had seen, he was in tears, literally. And he said, I don't know how you fix any of this. The problems are too big. I don't know what to do. I don't even know why it's worth doing. And we literally never heard from them again. They didn't become donors as we had hoped. Typically, you take these field visits and people get inspired, but this guy was so overwhelmed by the depth of the problem, the intractability seemingly of the problem, that we never heard from him again. He didn't find the hope, right? He didn't find the hope. And so it's easy then just to walk away and turn your gaze somewhere else and not pay attention to 31 million children in the sense of the global crisis. So what we have to find hope is in overcoming and in resilience, and in those places where the efforts of the refugees themselves, which is the most important part, but the support that we can provide along the way provides pathways for people. And I would say in this book, Tears of Salt, I didn't do a study on it, but maybe half the chapters kind of are this resilience and hope, and the others are incredibly depressing. So look for the hope.
Thank you. And these are lessons not just about the crisis, but about life in general that we can all apply. Yes. So my final question, and this is, for everyone on the call, we have people from across the world. We have two members joining in from Dubai, India, China, and my family has joined in from Nigeria. What is the lesson that you want everyone to take away from this keynote address today, the biggest lesson?
Two of them, if I can. One is the fact that we're in this both and moment. COVID is sucking up a lot of the oxygen in terms of people's attention, and it should, because it's a global crisis like we've never seen before, and it has to be stopped, and we have to address it. But as we're doing it, we cannot forget all the basic work that goes on in health, nutrition, education, child protection, all that additional work. So both and moments require more from all of us. So this is the moment for all of us to step up even more, to do what we can, not just in our own circumstances, but for people who really need us around the world. That's first. And the second one, I guess, for those of you who are students, just to think back about my own story, my own pathway of getting here, is really just be open to opportunity. I never envisioned being in the humanitarian and development space. I certainly never envisioned being a CEO of a large NGO, which I've had the privilege to do 3 times now. I've never envisioned any of that. It's not how I started out, but I just kept my antenna up enough to think about opportunity, to go to that, take that opportunity to work at the campus newspaper and find out that I loved writing and loved journalism. To take opportunities to, to have experiences like I did in Honduras, and to meet that nurse and keep my antenna up going like, I think what I want to do is something different than what I'm doing now, and find a pathway into it. So I just, I'm a big believer in planning, having a pathway, kind of knowing what you're going to do. And all of you are so bright. I know you have plans and paths, but just keep open to opportunity. Things that come across your path that you would have never thought about, because you never know where they might lead.
Keep open to opportunities because you never know where that might lead. That's such a good way to end. Thank you so much, Michael, for your time today. And for everyone who has joined us, we're so grateful. We have a 10-minute break and we start the next panel at 11 a.m. Thank you very much.
Thank you, everybody.